Hey, what's up, everybody? Hey, before I show you this video, I want to give you a trigger warning first. But thanks to everybody that sent me this video that's going viral on the socials right now about some doulas in a Piedmont, Georgia hospital that were with a mother, and they were removed from the hospital, and the mother was left to deliver the baby alone. So I want you to check out this video, and then I'll give my reaction at the end. So check this out.
So she'll be here giving birth all by herself.
Our doula client, who we are supporting, is desiring to have us here.
From the nurses, I'm going
Yes,
to
sir.
ask you both to leave.
Under what grounds
She has
are
no
you
one-
asking?
Visitation privilege.
So her
And I can
husband,
get the policy on the visitation privilege.
before you make that
when it's
decision,
impeding with care and the nurses, then it becomes an issue.
How are we
So
impeding
it
with her
is-
care?
I'm not going to get into that. That's what the
so
nurses
she's
are
by herself.
telling
Her
me.
husband's gone with the baby because they asked the baby to leave. So she'll be here giving birth all by herself. He had to leave with his daughter. So that means she's going to be in this room
So
all by
why
herself.
couldn't one of you or both of you leave
Because
with
she
the child?
requested.
She's requesting, we're not medically interfering. We're
just
literally
family
sitting
support.
here. But
So
because
that would-
we're sitting here now, all of a sudden we're medically interfering and we have to leave?
That's
Our-
my understanding.
But she has no one.
How is that understanding?
The nurse is right
I've
there.
been making my own decisions and making my own consent.
We have
We
no
have done
power.
nothing.
She has a mouth. We're just here to support her, giving her hip squeezes. She's going to be in this room by
I've been
herself.
here 5 hours with no pain medication whatsoever.
We are not
She's
speaking
impatient.
for her.
When it comes to medical, I don't get involved.
She's going to be in this room by herself to give birth.
She can speak for herself. They have no grounds to put us out of this room. Not at all.
Husband's gone.
All right, so if you had a chance to watch that, thank you for staying this long. And I want to give a quick reaction to it, so bear with me for 1 second. I think there are several different factors involved here. And if you followed this platform for any amount of time, you know that I'm all about advocacy. Having somebody with you, no matter if it's just a primary care doctor's appointment or what it is, have somebody there with you. When you're in pain and you're in distress, you can't hear everything. You can't take in and process everything, and you need somebody there for support. You need somebody to hear everything that was said and document everything, take notes, and do all those things to help you. So it's very important. And I am a very big supporter of doulas and advocates in the room with mothers, whatever it takes, especially with the maternal mortality crisis that we have in this country. It's very important that we have that. But also working in the hospital, particularly in acute care areas like the operating room, like I did earlier in my career, I also understand the other side of it too. And that part is the liability side. So it does not matter if you are a world-class surgeon in a hospital. If you are not credentialed to practice at a particular facility, you don't have liability of what happens to the patient while there. So if a doctor, which I've seen many times and orchestrated these, doctor comes from one facility to train somebody at another facility, that doctor doesn't have credentials there. So the outcome of the patient is not on him. It's on the hospital staff there. And so what stuck out to me is that the nurses requested that these doulas be escorted out of the facility, which is rare. But in the caption of the video, it talks about the patient being 8 centimeters dilated and the baby was in a frank breach, which is a pretty sticky situation for a mother and baby. And that is when the people who have liability, like the doctors and the nurses, are very heavily involved at that point. And so what could have happened, and I'm merely speculating, is that the nurses felt like the doulas were giving advice against what the doctors and nurses wanted to do, which in some cases is to convert to a C-section. And it sounds like, again, reading the captions, that the nurses wanted the mother to continue to wait and try to deliver vaginally. And so since doulas do not have access or credentials to the hospital and they are seen as a guest, even by law, Georgia has a no patient left behind law, which they advocate for people to be in the room. You are serving at the pleasure of the facility. So if the nurses and the doctors feel like you're impeding with care, they can ask you to leave. And it sounds like that's what happened here which was so unfortunate. So again, please take what I'm saying with a grain of salt, because this is based on a very small clip on social media. But I wanted you guys to see it and be aware of it and understand both sides, that we always want somebody with you. We want doulas in the room. We want advocates. We want consultants. We want family members, whoever we can have there. But there's also a different side of the doctors and the nurses there who actually carry the liability of what happens if something were to happen to that mother or that baby. So hope this helps. Want to see what y'all think about it. So please put your comments in the chat, and I'll be sure to respond to you guys. But again, sad case, because we never want this to happen, but I see both sides. So peace. Have a good one.